Hi, and welcome back to Focal Point on AFR Talk. I am your congenial, convivial, and amiable host, Brian Fisher. Welcome aboard the USS Focal Point, our patrol boat in which we patrol the choppy waters of America's public life, looking relentlessly for the intersection of truth and politics. Now, we've been following this business with Obamacare. We have talked some, not as much as I'd like to because of the pressure of the Chick-fil-A controversy, but about the fact that on August 1, Wednesday of this week, the Obamacare mandate went into effect, part of Obamacare, that mandates that every employer now has to pay 100% of the cost. Every employer, religious or not. Some organizations can get a one-year safe haven exemption, but then that goes away. August 1 of 2013, everybody's under this deal where they got to provide 100% of the cost of abortifacient sterilization morning after pills for their employees, and that's just going to promote sexual irresponsibility. Frankly, if employers are bringing 100% of the cost of contraceptives, 100% of the cost if you mess up and you get pregnant, 100% of the cost of the emergency contraceptives, 100% of the cost of sterilization, then you have the employers now bearing 100% of the cost of trying to minimize the consequences or the risks of sexually irresponsible behavior. So we're just going to get an explosion, frankly, of that kind of behavior, on top of which it violates the religious conscience of many, many Christian organizations and Christian employers. So we've been talking about that. We have been following that. It's a major violation of the First Amendment. And there are other aspects of Obamacare that people need to be aware of. And with us on our decision maker line is a frequent guest here on Focal Point, Twila Brase. Twila has become sort of our go-to guru on all things Obamacare and health related. She is the president of the Citizens Council for Health Freedom, and she is also the one who's responsible for the Health Freedom Minute that you hear right here on AFR Talk and frequently on Focal Point. Twila, welcome back to Focal Point with Brian Fisher.
Thanks so much, Brian. Glad to be here.
Well, it's good to be here, Twila. And just before we jump into what specifically I want to talk with you about, do you have any reactions to this mandate going into effect on Wednesday that at least in our judgment, violates religious liberty for Christian employers all over America?
Well, I think that really what it shows you is the power of the federal government through the federal health care reform law. I think that this is perhaps just the first of many provisions that the Secretary will decide must be mandated or can't be done, but many provisions that are going to violate the conscience, the rights, the ethics of individuals, not just the patients, but also the practitioners. So, it's sort of like one of those things where it's the beginning, and we now see what the beginning is, and I believe that if they think that they can get by with violating your religious rights, they're going to think that they can get by with violating all sorts of rights in the future, because they're the ones who get to decree what we all have to pay for.
And that's an intriguing perspective, Twila, that you mentioned there, that if they believe they can get away with violating our right to religious liberty, then there's no right, no privilege, no liberty that they won't trample on. When you think about the Founding Fathers, I mean, that was the very first of the liberties they were protecting in the First Amendment, was the right to the free exercise of religion. And Congress was prohibited, federal government, from meddling in any way with the free exercise of religion. And yet, clearly, starting on August 1, that has begun to happen. Well, let's talk about another issue. Twila, you have raised some concerns about a sort of a demonstration program. I was looking for the right word. A demonstration program that's coming down the pike that's going to represent, apparently, if I understand correctly, is going to represent an enormous waste expenditure of taxpayer money, perhaps without any legal authorization. Fill us in.
Right. The Government Accountability Office, otherwise known as the GAO, has been telling the Department of Human Services that there is a problem with this demonstration project. And the demonstration project is a plan to give bonuses to health plans, to insurers, for meeting certain quality measures. And the problem here is that Obamacare has a quality measurement bonus program. But what the department decided to do was to do their own demonstration project, which is not in Obamacare.
So in other words, so let me just interject there. So what you're saying, Twila, is there's no authorization from Congress anywhere in Obamacare for this whole plan. They're just taking money that they have no right to take and spend. Is that what I'm hearing?
Well, I guess perhaps it's a little different than that. They are authorized to do demonstration projects, but this particular demonstration project, according to the GAO, is in lieu of what is required under Obamacare, and it is about $5.34 billion more than is authorized under Obamacare, which means, according to the GAO, that it is it has seven times more impact on the American budget, than any other program since 1995. So it is an enormous expenditure of money. I don't consider it a demonstration program when it's in all 50 states. That's not a demonstration program. A demonstration program is like, you pick 3 states or 10 hospitals or something and you do a demonstration. But this is across the country paying more than $5 billion more than Obamacare even requires.
So you've got this bonus program that's in Obamacare, and they're just waiving that, virtually setting that aside and replacing it with this program.
That's
and
right.
Then they're spending like $8.3 billion instead of the $2-something billion that was originally authorized. And the thing, Twila, we're talking here with Twila Brase, who is the president of the Citizens Council for Health Freedom, is that this is their own law. I mean, they're telling us that they don't even like the law that they wrote and that they produced and that they shoved through Congress. They don't even like it.
Right, and here's the deal. The law itself, there are 2 things here, but I'll tell you one. The law itself gives the health plans $1 trillion. They get 98% of the new spending. So they get $1 trillion plus an additional $5.34 billion because it's above and beyond the $1 trillion that they get under Obamacare. The second problem is that the GAO says that they do not believe with the way that the program is fashioned that the department even has statutory authority to do it, because under law they can do demonstration projects, but they have to be able to prove that it has been effective. And the GAO says that they will not be able to provide credible evidence of effectiveness given how the program is laid out. So here you have a government agency saying to another government agency, we don't actually think that you have any legal authority to spend this $8 billion.
Now, let me ask you this question, Twila. I was looking at your news release on this, and the thing that occurred to me, and I don't know if you have a perspective on this, because it's a thought that just popped into my head as we were talking here. One of the complaints that we had about Obamacare is what it was going to do to Medicare Advantage. Medicare Advantage was a very popular program with seniors that provided supplemental insurance. They had choice of different providers. And Obamacare seemed to be stacked against these Medicare Advantage plans and shoving people toward these Medigap plans, which people like the AARP sold. So it's going to be a huge windfall for AARP because people were going to be shoved out of Medicare Advantage, which they like and which they chose, into these Medigap plans where there was fewer choices and fewer benefits. And so unpopular with seniors. And then here it looks like, if I understand it correctly, this is something that's kind of targeted toward these Medicare Advantage plans. And I'm just guessing here. Maybe I'm wrong, so correct me if I am. But it looks like maybe the Obama administration is trying to throw these billions of dollars at these Medicare Advantage programs because they're getting blowback from seniors that are going to vote in November that maybe they don't like what Obamacare is doing to their program.
It's hard to say what exactly the administration is doing. I think there could be at least 2 reasons they're doing it. One is they're getting blowback from the health plans, and 2 is they're getting blowback from the seniors. So they could say that to the seniors that, well, we're going to divvy out $8 billion to the Medicare Advantage program, so no worries, no worries. But they can also say to the health plans, we want to stay in office, and so here we are, sort of not under the table, but in a completely different route that the public's not even watching, we're going to give you this money, even though it doesn't necessarily fit what we can do statutorily. So it's, I think it's really hard to know. What we do know is that $500 billion is being taken out of Medicare and mostly targeted towards the Medicare Advantage program, these cuts. And now we have this. And so how to interpret that exactly, it's hard to say. But what it is a windfall for the health plans, and they don't really have to prove they did anything because the way the whole program's been set up, it lets all of them win.
Well, and I got a call this week from a listener who has a family member that works in an assisted care facility that relies heavily on Medicare funding and maybe Medicaid funding. I don't remember exactly. But they had just been informed this week that there is going to be a 10% across-the-board reduction in the reimbursements they were going to get from Medicare and Medicaid to take care of these patients. Now, I haven't heard anything about that, and I don't know if that's kind of flying below the radar. But once again, it seems like, when we talked about Obamacare, they were going to gut Medicaid, gut Medicare. $500 billion is going to have to come from somewhere, and it looks like they're starting to take it out of these programs.
When I look at what the purpose of Obamacare was, I think that it does go back to Medicare. I think you can actually blame Medicare for Obamacare because if you're a politician and you're looking at a $38 trillion unfunded liability in Medicare, you do not want to be in office when this whole thing blows up. So the whole idea for them is not to have it blow up. And the way that happens is to universalize, to nationalize the entire healthcare system so that they can put the money where they want it and take it away from where they want it. So they can tell all of us that we're covered.